मैं डॉक्टर दिनेश Mathur, retired professor of medicine, SMS Berry College, Jaipur. I am a practicing physician last more than 50 years and seeing various patients of all diseases. Diabetes is the most common disease prevalent in India today, and I am surprised that the prevalence of diabetes has gone so high in India that it is surpassing the China as well. So we are number two in level of diabetes among our population. The most important thing which all clinicians should remember that suspect diabetes at all age groups whenever there are certain signs which the patients may not note but you as a clinician must note, and they are sudden gain of weight, sudden loss of weight, finding yourself too weak, having body aches, leg aches, and muscle cramps, increased appetite, increased water thirst, passing more urine. All these are signs of diabetes. And whenever you suspect any patient with diabetes, it is mandatory to see the blood pressure because blood pressure is equally the killing disease. It is a silent killer. So the combination of diabetes and hypertension is very, very common. More in women, you have to suspect as a physician mixed edema simultaneously. These three things goes hand in hand as together in most of the female patients, those who are multipara, who have given birth to many children, or who are obese. Blood pressure is another important thing which we must look for, and the blood pressure reported by the doctor himself carefully is very important because taking a blood pressure is very crucial. You must take a blood pressure in right arm as well as the left arm, and if there is discrepancy, confirm again. First time when you see the blood pressure, the patient's blood pressure may be a little high, and that is called as white coat apron hypertension. The best is ask the patient to come back again after some time and review the blood pressure again. And if the pressure is more than 140 or 90 or 135 by 85, do treat, do not neglect it. And along with diabetes, if it is there, we have to be very careful that control diabetes and blood pressure and simultaneously look for lipid profile because that is another important thing which kills the patient. So we have to be very careful and simultaneously give one drug called an antiplatelet which stops clot formation and gives longevity of life. So one has to be very careful that you suspect diabetes, confirm fasting more than 100 or 120, HbA1c more than 6.5 needs treatment. Any sugar which is disproportionately high must be carefully monitored, and the most important is patient for the first time do not accept the diagnosis of diabetes easily. They go on insisting they will run, they will reduce weight, they will do this and they will do that and control diabetes. But that's a myth. Diabetes needs close monitoring and regular physician checkup and proper medication. Thank you.